In today's episode, I chat with Lucinda Harms. She is a pharmacist and the director of pharmacy at Advanced Health and CarePro Compounding. She often finds herself recommending supplements to patients who come into the pharmacy because we have such depleted diets in this country that it's really difficult for, if not impossible actually, for people to get everything that they need from their diet.
Integrative health has been around a long time, but I think the word integrative health has sort of evolved here in the last few years. We've got alternative modalities, things like aromatherapy and reflexology and Alexander technique, and even supplements and herbs are considered alternative because they're not mainstream Western medicine. And so you can either choose to use just those alternative modalities, or you can choose to use just Western medicine, traditional medicine, or you can put those two together and use the best of both worlds. And that's what we call integrative health, is taking the best of all of the different choices that we have and putting it together into a health plan for a patient that's going to help them get better, feel better, stay better. And so that's what specifically the modality that I work with is diet, and I'm not a dietitian, so I don't do diet plans for people, but there's oftentimes foods that people can't do because it's causing them problems, or certain foods that can be especially healing, and so we might work with specific food choices for them, and then we also would work with them for some supplements and herbs that might help them. And a lot of the people we see are people who failed Western medicine, and they need some other alternatives. They need something to go with what they're doing that isn't working very well. So, yeah, we have a good example. We had a young lady who came in several weeks ago, back in the middle of February, who had a really tight muscle in her back that she'd had a year and a half, didn't know how she got it, just was working out and started to have this back pain, and this muscle just was knotted up and wouldn't let go. And she'd been to a whole list of different kinds of practitioners, different kinds of modalities. I couldn't believe how many things she tried. She was definitely determined to get this resolved. So she came to me and I said, I'm not making any promises, but let's just see if we give the body the nutrition that it needs, if we can get it to heal on its own with the other things that you're doing. And we put her on some supplements, and she just emailed me this week. She made my day because she said she feels better than she's felt in a year and a half, and she's just feeling better, and she's going to continue the supplements and the chiropractic. And so that's a good example of how someone's kind of putting different modalities together, and with them together she's healing, whereas before she had not had any luck.